Hi there, this is the review of the randomized phase 3 clinical trial of 5 different arms of treatment for patients with cancer cachexia interim results. The study is stemming from a randomized control study of a phase 3 treatment plan that was established out in Cagliari, Italy, and it was done with 475 patients in total with 5 arms of treatment. The first arm of treatment for those positively diagnosed with both cancer and cachexia, which was defined as a loss of, within the past 3 months, let's see here, more than 5% of their ideal or pre-illness body weight, abnormal values for pro-inflammatory cytokines, the indication of clinical cachexia through antioxidative enzymes, or any other lab values that would do so through the oxidative stress of the patient. And they had to have a life expectancy of greater than 4 months in order to complete out the study. And some of the treatments, they excluded all women that were within their childbearing years, but you'll see that when I describe what treatment plans they went through. They measured their lab values and their anthropometry measures at 1 month, 2 months, 4 months, and 6 months. So again, they took 475 positively diagnosed cancer patients along with cachexia, and they put 95 into each arm, and they gave, in terms of different treatments for all of them, they gave some, let's see here, they gave some 500 milligrams of, let's see here, it was medroxyprogesterone acetate or megestrol acetate. Those are, as stated in Krauss, metabolic agents and cytokine blockers. No, they were appetite stimulants. They gave to another group EPA, or eicosapentaenoic acid, through enriched nutritional supplements. They used 3 different brands for the nutritional supplements, but there was no significant chemical difference in between those 3. It was primarily based off of whatever they could get for free from the manufacturer that they gave out to the patients. And the supplement was in quantity of EPA of 2.2 grams daily. The third arm had a supplement of 4 grams per day of carnitine, and the fourth arm had thalidomide. Thalidomide is an anti-nausea and anti-inflammatory agent, but it was came to a great, poor publicity in the 1960s as a result of its teratogenic factors within pregnant women and some of the birth defects that resulted as a result of it. Carnitine, to go back, that helps with the uptake of fatty acids from the cytosol to the mitochondria within the cell, and it's a micronutrient that is noted to be considerably deficient within cancer patients as a result of decreased nutrition and decreased caloric intake and some of the metabolic activities of the anti-neoplastics. Now, the results from these 5 arms, and in the 5th arm, by the way, they just took all of those different things that they were using and they combined them all together. And then they tried to see what the heck resulted as a result. So for those with the cachexia, they found that the people benefited the most from having taken, on an individual basis, carnitine or thalidomide, and those who combined everything, they also had some results in the following factors. They had an increase in their lean body mass, a decrease in fatigue, and in the case of thalidomide, they had an increase of lean body mass and a decrease of interleukin-6. And in this particular study, they measured items such as lean body mass through some pretty improved methods for nutritionists. They did dual X-ray absorptiometry for the lean body mass. They did for resting energy expenditure, which will increase in the presence of cachexia. They checked through indirect calorimetry, They checked for physical activity rates, whether they increased or not. They did that through pedometers and software systems. They checked serum levels of pro-inflammatory cytokines through ELUSAS, and that itself, it didn't really change too much except for in the case of thalidomide. And they checked fatigue with a symptom inventory that was approved. The problems with this study that may have been that they may not have defined cachexia or cancer-related anorexia, cachexia syndrome in the most strictly best way, but this was a quickly done study. And they stated that their definition of quality of life for these individuals may not have changed. It may not have been as well defined as possible. And they'd like to continue further study by evaluating patients that are positive for neoplastic malignancy, but they have not yet come down with cachexia to see if the introduction of carnitine or thalidomide, or the combination of the two, along with nutritional supplements like vitamin A and let's see here, they did polyphenols, 300 milligrams, they did 300 milligrams of alpha lipoic acid, they did 2.7 grams of carbocysteine daily, and 400 milligrams of vitamin E daily, 30,000 international units of vitamin A, and 50 milligrams daily of vitamin C. All of those nutritional supplements that I mentioned, all patients had taken all 495 of these. So, what they were really looking at is the introduction of carnitine or thalidomide within their diets. And then another thing to mention about the study is that there's a possibility of misunderstanding. If you look at carnitine sources within the diets, within the allometric diets, then it's really meat and dairy. And the American Cancer Association, or the American Cancer Society, recommends for the prevention of cancer that you have a diet rich in fruits and vegetables. So carnitine and the increase of consumption of carnitine should be strictly in the presence of cachexia at this point, and that's all that should be said about it.